watching this video, you're concerned about your dog's or cat's oral health. Through the video, we're going to go through the steps of what dental cleaning entails, and we're going to talk about common signs of what oral disease looks in dogs and cats, and common questions of anesthetic safety for your pet. If at any point during the video or at the end you still have questions, feel free to schedule an appointment with our doctors, and we'll make sure that we can answer any questions and really make a plan that's tailored for your dog or cat as far as treatment or even oral health care. When the dog or cat comes in that morning, he or she will receive a thorough physical exam where the doctor will examine the heart and the lung tissues to make sure that the pet is going to be a good anesthetic candidate. They're also going to receive blood work that day for us to be able to evaluate the internal organs if it was not done a few days before. If we find changes in the liver or kidney values, we can either postpone the procedure or make minor adjustments to drugs or drug calculations to make it safer for that pet. After everything's being checked out that the pet is a good anesthetic candidate, the pet is going to receive pre-surgical medications that include pain management and sedation. This is going to relax the pet and it's going to allow us to place the IV catheter on a calm patient. And it's also going to let us use less anesthetic during the procedure, making it a safer anesthetic procedure. Once the IV catheter is set, we're actually going to apply oxygen, have the animal breathe some oxygen before induction, again raising the safety of anesthesia. Once induced, our technicians are going to place a tube to keep the trachea open so oxygen can be delivered to the lungs and all the tissues, and it's also going to prevent fluids from entering the lung tissue. The technician is going to go ahead and scale above and below the gum line. We're going to remove that plaque, and that key step of removing the plaque from underneath the gum is very important, or dental disease is going to progress. Then the veterinarian is going to examine each tooth, examine any abnormalities above the gum, check the depth, make sure that the attachments are intact. And if there's any question about the tooth itself, we can take an x-ray to evaluate that tooth underneath the gum line. And that's very important. Not all veterinarians have this piece of equipment, and we want board certified dentists are moving into making this a standard of care. It's very easy to miss disease by just looking at the tooth, and that's where the x-rays are going to be important. We can pick up fractures below the gum line. We can pick up abscesses that would otherwise go unnoticed, and they're painful for the pet. Once we make a treatment plan, the doctor assesses all the teeth. We're going to contact the owner while the pet is under anesthesia. We're going to communicate our plan if any extractions are needed, and the veterinarian is going to proceed with those extractions and suturing of the pockets if any extractions were done. Then the technician is going to finish by scaling the teeth, and this is going to polish everything and prevent the tartar from forming if it's left undone. And then the recovery period starts for the patient. A lot of times, actually, before the recovery, we'll apply Sano sealant, where it's almost like applying wax to your car. It's going to prevent the tartar from forming faster, and it lasts 6 months, and it's definitely going to help along with the home dental care.
Hi, my name is Paula Bruton, and these are my lovely two dogs, Henry and Mackie, who are both patients here at Animal Oasis. I just wanted to take a minute and tell you my experience with my last dental on Henry. He is an 8-year-old schnoodle, and he came in with horrible dental procedures. He's a rescue, and he has a deformed lower jaw. So I brought him here, and I'd love to show you some pictures because they're so outstanding. This is when I brought Henry in, and his mouth was in just really tough condition as a rescue. This is his after, and you can see how beautiful. They did an amazing job with his teeth. He recovered absolutely fabulous. No after effects, no nausea, ate his normal dinner, and was in tip-top shape that evening. If you are looking for the utopia of veterinary service, you are at the place. Look no further. I have been with Animal Oasis since the day they opened their doors. All three of their veterinarians their vet techs, their dental assistants, their front desk staff. Everybody makes your life so easy as well as your pets. I rescue dogs that nobody else wants, that have the problems and the challenges that no vets really like to face. And I have had the most amazing experience at this veterinary service. I would recommend it so highly to anyone looking for the best care for their animals.
Thank you for watching this video. We definitely hope that you learned a lot about your dogs and cats' oral health and you feel more comfortable about your veterinarian's recommendation for oral health. If you have any questions, give us a call at 239-431-7980 and we'll be more than happy to answer any questions or schedule an appointment to examine your dog's or cat's teeth.